Hi friends, welcome back to our YouTube channel, one and only pharmacy. So friends, in today's video we see detailed notes about anticholinergic chapters or parasympatholytics, subject pharmacology, D pharmacy second year. So friends, please watch this video till the end. Let's start. A definition of anticholinergics. That means these are the drugs which block the cholinergic receptor present in the organ supplied by cholinergic nerves. What is anticholinergics? Anti means block, or cholinergics means cholinergic receptor. Let's see again. These are the drugs which block the cholinergic receptor present in the organ supplied by cholinergic nerves. Example of anticholinergic: atropine or hyoscine, etc. They block only muscarinic actions of acetylcholine. That means also called as an anti-muscarinic receptor. Mechanism of action of atropine. In this video, friends, in this video we see detail about atropine drug, its mechanism of action, its contraindications, its uses, its side effects, and atropine poisoning. Let's see first mechanism of action of atropine. Atropine shows competitive antagonism with acetylcholine at a muscarinic receptor. Atropine has higher affinity for muscarinic receptor than the acetylcholine. That means it's block the acetylcholine. That means acetylcholine and atropine acts on the same receptor. It's an antagonism to each other, but atropine has a higher affinity, but it has no efficacy. Atropine does not interfere with the release of acetylcholine in the skeletal muscles. Hence, its nicotinic actions remain unchanged. The blockage of muscarinic receptor produced by the atropine can be overcome by increasing the concentration of acetylcholine. The blockage of muscarinic receptor produced by the atropine can be overcome by increasing the concentration of acetylcholine. Its mechanism: pharmacological action of atropine in a different organs. How atropine is act. First, action on glands. There are several glands like salivary secretions, gastric acid secretion, bronchial secretion, and sweat secretion. Let's see one by one. Atropine decreases the secretion of the glands except the production of milk. First, salivary secretion. Atropine decreases the salivary secretion and produces dryness of mouth. Hence, there may be difficulty in swallowing. Second, gastric acid secretion. Atropine produces a decrease in the gastric acid secretion and thus it reduces acidity. Bronchial secretion. Atropine reduces bronchial and nasal secretion. Hence, it can be used as an anti-cold tablets. Last, sweat secretion. Atropine reduces the sweat secretion and leads to increase in a body temperature. That means pyrexia. Pyrexia means body temperature is higher than the normal. These are the pharmacological action of atropine on glands. Second, action on smooth muscles. First, GIT. Atropine decreases the contraction of intestinal smooth muscles, which reduce the peristalsis. Hence, atropine is known as a spasmolytic or antispasmodic because it reduces the peristalsis. Second, smooth muscles, that means bronchial muscle. Atropine causes the relaxation of bronchial muscle. Atropine causes the relaxation of bronchial muscles, hence it can be used in reducing a bronchospasm. Spasm means contraction. Action on CNS, that means central nervous system. Atropine causes the stimulation of medulla oblongata, which stimulates the respiration and increases the rate of respiration. Hence, atropine can be used for treating the respiratory depression produced by the anticholinesterase. Second, action on cardiovascular system. Atropine produces an increase in the heart rate, that is tachycardia. That means heart rate is higher than the normal value. Sometimes it may lead to a cardiac arrhythmia. That means higher dose of atropine is dangerous. Action on urinary system. Atropine increases the secretion of antidiuretic hormones, that means ADH, which decreases the diuresis. Hence, there is a urine retention. This action on urinary system. Action on eyes. On local administration, atropine produces mydriasis, that is, increases in pupil size. Hence, the person can see the objects which are at a longer distance but fails to see the objects which are at a nearer distance. These are the actions on various systems like serious urinary system. Adverse effect of atropine. What are the adverse effects of atropine? There are 8 main adverse effects. First, cycloplegia. Second, photophobia. Third, dryness of mouth. Difficulties in swallowing. Retention of urine because of ADH. Cardiac arrhythmia. Some allergic reactions like dermatitis. These are the some adverse effects of atropine. Therapeutic uses of atropine. Why we use atropine? As a pre-anesthetic medication for reducing the excessive secretion of saliva and respiratory tract, in the treatment of bradycardia, in the preparation of antichol tablets, as an antispasmodic in the treatment of different GI disorders, as an antidote in the treatment of organophosphorus compound, in the ophthalmic preparations, in the treatment of Parkinsonism, as it reduces the gastric acid secretions used in a peptic ulcer. These are some uses of atropine. We use contraindications of atropine. In which conditions we are not given atropine? First, atropine is contraindicated in chronic lung conditions as it may produce drying and reduce the secretion. Second, overactive thyroid glands. Second, myasthenia gravis, a skeletal muscle disorder. Second, close angle glaucoma. Second, high blood pressure. Next, coronary artery disease. Next, chronic heart failure. Next, asthma. And next, a change in saliva secretion. These are the some conditions that means contraindications of atropine. Second main point about this chapter is atropine poisoning. That means atropine is higher concentration in our body. Actually, atropine has a large therapeutic index that is wide margin of safety, but it sometimes leads to severe toxicity due to the blockage of parasympathetic receptors. That means the atropine poisoning occurs. Symptoms of atropine poisoning: burning sensation of mouth, increase in thirst, photophobia, cycloplegia, urine retention, increase in body temperature, that means pyrexia, some allergic reactions like dermatitis, skin becomes dry and hot, cardiac arrhythmia, CNS effects like confusion and hallucination. These are the some symptoms of atropine poisoning. Treatment of poisoning. How we treat atropine poisoning? Gastric lavage. Contents of GIT can be washed out due to which drug can get removed from GIT. That means first treatment is gastric lavage. Administration of parasympathomimetics like physostigmine. These are the antidotes of atropine poisoning. Atropine is a parasympatholytics. In the treatment of that, we use parasympathomimetics like physostigmine or neostigmine. Administration of IV fluids. Use of ice bags for reducing the body temperature. As atropine produces photophobia, keep the patient in a dark room. Oxygen and artificial ventilation in the event of severe respiratory depression. Good nursing care. These are some treatment of atropine poisoning. Antidote for atropine poisoning: physostigmine and neostigmine. These are the antidote for atropine poisoning. Thank you guys for watching this video till the end. Friends, if you new on this channel, so please like, share and subscribe to our YouTube channel for pharmacy related daily videos. Thank you guys. Let's see once again what we see today's video. Antidote for atropine poisoning is physostigmine and neostigmine. Some treatments of atropine poisoning. Symptoms of atropine poisoning. What is atropine poisoning? Contraindications of atropine. Therapeutic uses of atropine. Adverse effect of atropine. Pharmacological actions of atropine on different systems. That means action on the eyes, action on urinary system, action on cerebus, action on smooth muscles, action on CNS, action on glands, mechanism of action of atropine and definition. Thank you guys.